So I'm back, and our next session, we're going to talk about the Laboratory Identified Event, or LabID event module for long-term care facilities, and I'm going to start with C. difficile infections. I do have an announcement for our web streamers, public service announcement to our web streamers. Hello out there. There is a form on the website, on the web streaming on the NHSN website, training website, and that form allows you to submit questions to the presenters. Be sure that you are using the form to submit questions to the presenters and not random questions. We hope to be able to entertain some web streaming questions to be able to include you all in our presentation since you can't be here. For this session, we will describe the rationale for monitoring Clostridium difficile infections, referred to, or you will hear me refer to it as CDI, in multi-drug resistant organisms. We will describe the setting, requirements, definitions, protocols for CDI and multi-drug resistant organism LabID event reporting. Review the correct method for entering CDI and MDRO LabID events into NHSN. And we will apply knowledge through case studies using those great clickers you have on your tables. LabID event reporting is an objective laboratory-based metric that allows the following of allows facilities to clinically evaluate residents and to determine an estimate of healthcare acquisition, estimate of infection burden in your facility, an estimate of exposure burden in your facility, as well as to assess the need for effectiveness of your interventions and to standardize case definitions. The metrics that I will be talking about today in the LabID event module were adopted from from literature from the Society of Healthcare Epidemiology of America and the Infectious Disease Society of America. And here are the articles on your handouts or on my slides if you're interested in reading those. There are several options for reporting within the LabID event module. Users have the option to report C. difficile as well as common multi-drug resistant organisms, or MDROs. Within the module, users may elect to follow one or more. So for an example, a facility may only submit data for C. difficile infection events, or a facility may only submit data for MRSA LabID events. So facilities have the option to select one or more of these. CDI, or an MDRO LabID event reporting, is available to certified skilled nursing facilities and nursing homes, as well as intermediate chronic care facilities for the developmentally disabled. When participating in CDI surveillance and MDR surveillance and reporting, surveillance must occur for all resident care locations, and this is referred to as facility-wide inpatient, or FAC-wide-in. There is not an option for facilities to only report out of one resident care location. And so this is a little bit different from our acute care partners, right? Laboratory results obtained before a resident's admission into your facility or during an inpatient admission to another facility are excluded from FAC-wide-in. So I mentioned earlier a little bit about the exclusion for the setting, or the exemption for the setting. Laboratory results collected from an emergency department or an outpatient setting. What I mean by outpatient setting is maybe a physician's office or a clinic. Those can be used for LabID event reporting for your facility if the resident returns to the long-term care facility on the calendar day of transfer to that outpatient setting or the very next calendar day. In other words, there is no change in that current admission status. If the resident goes to the emergency department and subsequently gets admitted to that emergency department, then that specimen, any specimen collected in that ED, is not going to be reportable out of the long-term care facility, right? Because the resident is not returning the very next calendar day. Or let's say that a resident leaves your facility, goes to the emergency department, gets admitted into that facility, and a specimen is collected. That specimen is not reportable from your long-term care facility because it was collected during an inpatient admission. So the exception is only for specimens that are collected in that outpatient setting when the resident returns immediately back to the long-term care facility, either that calendar day or the very next. Is that better? And I have some case studies, and again, we'll be talking about this more today. So let's look at an example. Mr. T is a resident in your long-term care facility. He does not have a history of C. difficile. On March 1st, he was transferred to the local emergency department for evaluation of diarrhea and fever. While in the emergency department, a loose stool specimen tested positive for C. difficile. He received IV fluids and was transferred back to the long-term care facility on March 2nd, so calendar day number 2. Since the specimen was collected in the emergency department and during Mr. T's current admission to your long-term care facility, the C. difficile specimen was entered into NHSN as a CDI LabID event for the long-term care facility. Again, here is our website for access to the event training modules, forms, protocols, supporting materials, and analysis resources. So we're going to talk first about the Clostridium difficile LabID event reporting. Remember I told you that Dairy Queen is offering free ice cream cones? I recommend the chocolate. Okay, so just a little bit of background about Clostridium difficile infections. We know that it's an anaerobic bacterium. It is not normal intestinal bacterium. I hear this sometimes that, it's normal to have that in your intestines. It is not. It is spread the fecal-oral route. What happens with this spore is or with C. difficile is it forms a spore that is persistent and it's hard to kill. The toxins produce colitis, stomach pains, diarrhea, and more severe disease can cause death. And we are seeing this in our older populations. There are 2 steps to infection. Antibiotics, of course, result in vulnerability. And Janita, I think, was saying that some of the literature that she looked at, I think up to 76% of the C. difficile they were seeing in the elderly population was related to antibiotic use. Once the person becomes vulnerable, then new acquisition occurs via transmission. So contaminated hands of your healthcare workers, contaminated equipment that comes in and out of those resident care rooms. A reoccurrence, we are seeing the last study that I looked at, reoccurrence was up to 30%, and that was in resident or patients that were treated successfully. So that is not resident specific. So pretty significant stuff. We know why it's important in nursing homes. I think we all know that, so I can just skip the slide, right? So. Advanced age, we know, is a leading cause of, one of the most important risk factors for C. difficile. It is the leading cause of diarrhea in our nursing homes. It contributes to approximately 14,000 deaths each year, with about 90 or more percent of the elderly, greater than 65 years. These numbers were taken in 2012. It would be really interesting to see what the numbers are now. We do not have access to that data, and we're hoping that as more users come on board with NHSN, we will have that data. But I think even in 2012, this was significant. Prevention activities, we also know, are helping to reduce the amount of C. difficile infections that we're seeing. Stewardship programs, which are really starting to boom right now. Hand hygiene is shown to prevent the spread of C. difficile. And of course, infection prevention in these long-term care facilities. There are some key risk factors according to the literature and what we're seeing out there for you to target your prevention. Antimicrobial exposure being a big one. Acquisition of C. difficile, so that contaminated hands, contaminated equipment, so forth. Advanced age, can't really do anything about that. We're all getting old. Underlying illness, which again makes our elderly more vulnerable. Immunosuppression, tube feeds, there's some debate on that in the literature, and then gastric acid suppression. What we can control in our facilities is antimicrobial exposure and acquisition of C. difficile, which is what we hope that will come out of effective surveillance within the long-term care facilities. When thinking about C. difficile surveillance and prevention in your facility, there are several questions to ask yourself. Specific to if I should jump on board with this NHSN surveillance thing, you may want to ask yourself, how do we define C. difficile infection currently in our facility? Do we have a definition for it? How do we track and measure C. difficile infections in our facility? There are some other questions that you guys can review on your handouts. Jumping right into the requirements for NHSN reporting and submission of data. We talked about this NHSN monthly reporting plan. I think you're going to dream about it by the end of the day because I'm going to talk about it so much. But the reporting plan must be completed for each calendar month in which your facility will submit data into NHSN. For each participating month, and what I mean by participating month, as each month that you do have a monthly reporting plan on file, facility must submit numerators, which are your C. difficile infection events or LabID events, and denominators, so the number of resident admissions, the number of resident days, and number of admissions on C. difficile treatment. This must be submitted for the entire facility. So remember, there's no unit-specific surveillance with the long-term care facility. So the entire facility, all resident care locations must be included. And again, we talked about performing our test only on unformed loose stool samples. We talked about the steps to adding a monthly reporting plan, but I do want to, again, talk about this specifically as it relates to C. difficile in your monthly reporting plan. So on the left navigation screen, you'll go to Reporting Plan and then click Add. Select the month and year for which you plan to conduct surveillance and submit data to NHSN. Remember, there are 3 modules that you can report from. You can pick reporting out of each of the modules, or you can select one module. If you're only interested in looking at C. difficile infection events in your facility, then you go to this LabID event module. The locations is the default for FAC-wide in. You'll have a drop down for specific organism type, and you'll want to select C. diff or C. difficile. And then you'll notice in the last box, this is LabID event, all specimens. This is the default for all participating organisms or events in the LabID event module. This does not mean you're looking for C. difficile in all specimens. You're still only looking for it in the stool, but this is the default for the module. And so you would follow the protocol, which again is specific to stool specimens, loose stool specimens. Don't forget to click Save at the bottom of the screen. We talked about the forms. Remember, the forms are customizable. There is a form specific for MDRO and LabID event reporting. One form per event should be completed if you choose to use the form. This form is designed to collect all of the information that will be required to enter into the NHSN application. Again, this form is available in PDF version as well as Word version if you wanted to add some customization to the form for your facility. And I have the websites included in your handouts. So let's talk a little bit about this definition of C. difficile. For NHSN reporting, only loose stool samples should be tested and reported. C. difficile is identified when the resident has a positive laboratory test for C. difficile toxin A and or B, or toxin-producing organism through a culture. Testing methods do vary, but the most important identifier is that toxin positive or that PCR positive test in your facility. And just remember that you should only be performing C. difficile toxin testing on loose stool samples in your facility. Otherwise, you run the risk of capturing colonization or non-infections. Okay, now that we've talked about the definition of a C. difficile positive laboratory assay, let's review the definition for a CDI LabID event. Any positive laboratory assay, again, tested on an unformed stool specimen and collected from a resident who is receiving care from the long-term care facility with that one setting exception, and the resident has no prior positive laboratory assay collected in the previous 2 weeks, so less than 15 days, while receiving care from that long-term care facility. Duplicate, so you may hear CDI LabID event referred to as a non-duplicate CDI LabID event. Non-duplicate CDI LabID events are not reported into NHSN, so only your non-duplicates that meet this definition that's up on the screen should be reported. So there should be a full 14 calendar days between positive laboratory tests before you report a new one into NHSN, and we're going to look at some examples shortly. So a duplicate, which I got ahead of myself, is any C. difficile positive laboratory assay from the same resident following a previous positive laboratory assay within the past 2 weeks, okay, less than 15 days. Figure 1 is located in our protocol. It is also located in the resource manuals that you all have if you're on site here. I find that this is the easiest way for me to remember our definitions and our criteria. I have this printed for C. difficile as well as for UTI, and I have them lined in my office, and I recommend that you all do the same. It may be helpful, especially if you're fairly new to LabID event reporting, if you have a line listing or keep a log of all of your positive laboratory tests. And that will allow you to only report the non-duplicates into NHSN. And this is important because while the NHSN application has business rules in place that prevent a user from entering a duplicate LabID event, these business rules only capture based on the previous LabID event that you entered into the application. The NHSN application does not know about the other positive laboratory tests that resident may have. So the business rules are only as good as the data that's going into the system. So your own personal line listing will be helpful for you. We're going to look at some examples. The clickers do not work with the table examples I have. I'll let you know when it's time to pull out the clickers. So we're going to assume that all C. difficile test results for a resident in the long-term care facility are available here. So our first one, the specimen is collected on 2/3. Is this a duplicate? Nope. And should we submit this as a CDI LabID event? Yes, this is the first specimen that we have for this resident. The next specimen was collected on 2/11, so what is that, 9 days later? Is this a duplicate? Should we submit it to NHSN? Very good. It's within 2 weeks. The next specimen was collected on 2/19, so that was 9 days, so is it a duplicate? So remember, the duplicate is based on the most recent laboratory test, not the most recent LabID event. This is one area that tends to cause some confusion with the users. So it is a duplicate, so do we submit it? No. Again, on 2/29, it is a duplicate, so we do not submit it. And then 3/19, no, and so we would submit that. So hopefully that helps to bring some clarity. I am not advocating for any facility to do this many stool tests on one resident, just so you know. Okay, so next I want to talk a little bit about the steps for submitting a CDI LabID event into NHSN. To enter a CDI LabID event, or any event for that matter, on your home page, you're going to click Event and then click Add. As you can see, you also have the option to find events and for incomplete. So find would be if you needed to review an event that you've already entered, you could click find and look that event up. Incomplete would be selected if you wanted to look at any LabID events that perhaps you did not, that are incomplete. Maybe you didn't finish entering the data for. So for the purpose of this exercise, we're going to go with add. Once you click Add Event, everything marked with a red asterisk must be completed. The facility ID will auto-populate for you, and the user will need to enter the resident information. Resident type, I want to spend a little bit of time on because this, I think a lot of you know this, but some users do get a little bit confused. For resident type, users will select between short stay or long stay. A short stay resident type would be a resident that has been in your facility for 100 days or less from the date of first admission. And then a long stay is defined as a resident being in your facility for greater than 100 days since the first date of admission, which brings us to what is the first date of admission? So we have the date of first admission is the date that resident first entered your facility. The date remains the same even if the resident leaves your facility for short periods of time. Anything consecutive under 30 days, the resident's date of first admission will not change. Then we go to the date of current admission, and that is the most recent date the resident entered your facility. So we have the first date as being the date of first admission, and then the current is the most recent date the resident entered your facility. If the resident enters your facility for the first time and has not left for greater than 2 calendar days, then the date of current admission will be the same as the date of first admission. However, if that resident leaves your facility for greater than 2 calendar days, and the day that the resident leaves equals calendar day 1, so if the resident leaves for greater than 2 calendar days and returns, the date of current admission should be updated to the date the resident returns to the facility. Let's look at an example. A resident in your facility since February the 1st is transferred from your facility to an acute care facility on June 2nd and returns on June 10th. The current admission date would be 6/10 for June 10th since he was away from the facility for greater than 2 calendar days. The date of first admission remains as 2/1 since the resident did not leave the facility for greater than 30 days, calendar days. 1 week later, the same resident goes to the emergency department for evaluation on June 15th and returns on June 16th. The date of current admission stays as June 10th since he was not away from the long-term care facility for greater than 2 calendar days. Next, once the resident information is complete, you will scroll down to the event information section. For event type, select LabID event, and then the date of event will be the date the specimen was collected. After selecting event type and date of event, the remainder of the page will populate with additional relevant questions. The first being the specific organism type. Since we are reporting C. difficile, you will select C. difficile, and when you do that, the next box will auto-populate for you with the specimen body, site, which is the digestive system, and the specimen source, which is a stool specimen. The next box requires the user to enter the location of the resident at the time the specimen was collected. Remember, the populated resident care locations are added during the initial setup. So remember, we talked about these are the locations that you added when you initially set up your system into NHSN. I want to point out, if the resident had a specimen collected from an outpatient setting, such as that ER or that clinic setting, then the resident care location will be the location that the resident was in prior to transferring out. Okay, so the same location. The next box, the user will select for the primary resident service type. In this box, you want to select the single primary service that best represents the care the resident was receiving. In this box, want to point out is not populated based on anything that the user sets up. This is the CDC-defined locations that we talked about earlier. For the next question, enter yes if the resident has been an inpatient of an acute care facility and was directly admitted to your long-term care facility in the past 4 weeks. Otherwise, select no. If you select yes, then 2 additional questions will populate: the date of last transfer from the acute care facility to your facility, and was the resident on antibiotic therapy for this specific organism at the time of transfer to your facility? Yes or no? Keep in mind, this question is only referring to the resident being an inpatient in another facility. It is not referring to any time the resident spends in an outpatient setting. So if the resident only left your facility to go to an emergency department, then the answer would be no. So only if the resident was subsequently admitted as an inpatient would you answer yes. The final question, documented evidence of previous infection or colonization with this specific organism type from a previously reported LabID event in any prior month. This is auto-populated by NHSN and it is not editable. My advice to you would be to ignore this question because it will drive you crazy. We get many questions from users frustrated because they are unable to change the answer because they know the answer is incorrect. It doesn't matter. This is a non-editable field, meaning there's nothing a user can do to change this. And this is actually based on any previous positive LabID event in a prior month. It could be a year ago, and this would still populate yes. And the analysis folks use this behind the scene for some of the analysis metrics. If you're interested, you can talk to Elizabeth for additional information. The last 2 fields are optional, but I think these are fantastic fields, so I do want to spend a little bit of time on them. They can be used by the individual facility or for group users. The custom field allows users to set up to 50 fields in the NHSN to customize data that you want to collect for your facility. Again, this is optional information that may be helpful in your surveillance practices to your facility. For example, we have one facility and they collect for C. difficile prior history of antibiotic use. They even have specific antibiotics listed as custom fields. And so when you're completing an event for a resident, you would select yes or no. Was the patient on a fluoroquinolone? Yes, no. Was the resident in XYZ acute care facility? Yes, no. So this is data that may be important to your facility. NHSN does not use this data for anything, and it is not included in any of our analyses, so it's strictly for your internal facility purposes. The comment section is a place for you to free text whatever information that you want to put about the resident. Again, this could be important information for your internal process or quality improvement purposes. So I highly recommend that you check out these 2 optional data fields. If you have questions, certainly send us an email. If you need help setting up the custom fields, because the custom fields do have to be set up before you start reporting events, I am happy to help you do that. This screenshot, if you can see it, provides an example of what a complete C. difficile LabID event will look like. Once you submit or click save, you will receive a pop-up notification confirming that your event was created successfully. It will give you an event number. Don't feel like you have to write this event number down because you can still find events based on the month and year that you entered events. But some users do like to keep a log of the event number. Denominator data. Similar to the event forms that we've already talked about, the denominator data also has forms. These are the 2 forms available to you. I know we've spent a lot of time on these forms, so I will not talk about them again, only to say that remember, only the aggregate data goes into NHSN when you're collecting denominator data. So even if you use this bottom form that's called Denominators for Long-Term Care Facilities, which allows you to collect your denominators each day of the month, only the totals go into the NHSN application. So as a reminder, the denominator data are entered on the summary page by clicking Summary and then Add. I'm going to walk you through the steps here for entering C. difficile specific denominator data. So once we click Add for our summary data, the next thing is to select the month and year in which you will be entering the denominator data. Everything with a red asterisk is required for you to enter. Okay, so you will take the total monthly count of your resident admissions and your resident days and enter those in the boxes labeled accordingly. And also the monthly total of the residents who are receiving C. difficile therapy at the time of admission into your facility. A check mark must also be entered under each box in which no data was submitted. And I'm going to talk about this a little bit more as we progress. So as you can see here, for this, so remember I said that your summary data parallels what you put in your monthly reporting plan. So our monthly reporting plan says that we are only following C. difficile LabID events. So you can see on this first row here, LabID event for C. difficile is selected, but it's grayed out. What that means is that we have actually entered event data into NHSN for C. difficile. If we had not entered any C. difficile LabID events for the month, the box would look like this on the bottom right-hand side of my screen, so it would not be grayed out and you would have a red asterisk. And what that means is that you need to put a check mark in that box indicating that you are confirming that, yes, I am reporting C. difficile LabID events for this month, but I didn't have any to report. So you're just confirming that by checking yes. I want to talk a little bit about the denominator question, number of admissions on C. difficile treatment. Again, this is the monthly total of admitted residents who are receiving antibiotic therapy for C. difficile infection at the time of admission. This does include new admissions and readmissions into your facility. The count number of admission, so you would want to include treatments even if the infection being treated did not meet the NHSN C. difficile LabID event definition. So you're looking at treatment and not necessarily if that resident meets the NHSN criteria. Similar to when entering an event, you will receive a pop-up to let you know that your denominator data is submitted successfully. So I've highlighted the bottom right-hand corner to give you an example. So this is a complete summary data. So you can see we have our month and our year. We have our resident admissions, resident days, the number of admissions on C. difficile treatment. We did report C. difficile events for the month, so there's no need to select the box report no events. This is a complete summary for us. And then we're going to click Save. I want to talk a little bit about LabID event categorization for C. difficile infections. Elizabeth is going to talk more about this during the analysis section, but I want to give you a sneak peek. NHSN will categorize your C. difficile LabID events based on current specimen collection date and prior specimen collection date of a previous C. difficile infection LabID event that is entered into NHSN. So remember, NHSN does the categorization for you, and it is based on data that are entered into the application. NHSN does not know about data that happened in other facilities or that were not entered into NHSN. So we have incident CDI LabID event is defined as any CDI LabID event from a specimen collected greater than 8 weeks after the most recent CDI LabID event submitted to the NHSN application, or the first ever CDI LabID event submitted for that resident while in your facility. Then you have recurrent CDI LabID event is defined as any LabID event submitted to NHSN after 2 weeks and equal to or less than 8 weeks after the most recent CDI LabID event submitted to NHSN for an individual resident in your facility. So let's look at an example here. A resident with a positive CDI test result. You want to ask yourself, was there a prior positive CDI test result in the past 2 weeks? If no, then you would enter this into NHSN. If yes, then it's considered a duplicate and you would not enter it. If you do enter the LabID event, because it's a non-duplicate, then the application will categorize the event as an incident or a recurrent. In addition to incident and recurrent, NHSN will further categorize CDI LabID events based on the date of current admission to the facility and the date of specimen collection. You have your community onset LabID events, and that is defined when the date of specimen collection occurs 3 days or less after the current admission to your facility. So if it's collected on day 1, day 2, or day 3 of admission. Long-term care facility onset LabID event, specimen collected more than 3 calendar days after the current admission. So any specimen collected on calendar day 4 or after will be categorized as long-term care facility onset or low. The long-term care facility onset LabID events are further categorized by NHSN depending on if the resident has spent time in an acute care facility in the previous 4 weeks. And that is called acute care transfer, long-term care facility onset, or more easily stated, ACLO. These are long-term care facility LabID events where the specimen collection date equal or less than 4 weeks following the date of last transfer from an acute care facility. Here's an example here. So March 1st. So if your resident was admitted to your facility, a current admission of March 1st, then any specimen collected on March 1st, March 2nd, or March 3rd is categorized as community onset. Anything collected March 4th or later is categorized as long-term care facility onset. Keep in mind, both community onset and long-term care facility onset LabID events must be submitted to NHSN. So even if the specimen is collected on day 1 of that current admission, you would still need to submit that as a LabID event to NHSN. And this is important because these data impact incidence and prevalence data that is analyzed for your facility. And again, Elizabeth is going to talk more about that. Some key points for CDI LabID event reporting. This is just a synopsis of what I just talked about. You want to include results from tested on loose stools only. When performing LabID event reporting for C. difficile infection, a facility must identify and report from all resident care locations, referred to as FAC-wide in or facility-wide inpatient. All non-duplicate C. difficile laboratory assays should be submitted to NHSN, and this includes community onset events. Duplicate C. difficile laboratory assays should not be reported to NHSN, so anything under 15 days from the last positive laboratory test. When applying the LabID event rules, the date of specimen collection is considered as day 1 of the count. And then NHSN recommends keeping that internal line listing log of all of your positive laboratory results so that you can correctly apply that 14-day rule. Laboratory results obtained before a resident's admission to the long-term care facility or during admission to another facility are excluded from LabID event reporting. LabID event rules apply to specimens collected while the resident is receiving care by the long-term care facility, and this does include specimens from an emergency department or outpatient setting, such as a clinic, when the resident returns to the long-term care facility on the same calendar day as transfer to the outpatient setting or the very next calendar day. If a specimen is collected while the resident is receiving care in that emergency department or outpatient setting, remember the resident care location and primary service type should indicate the resident's primary location and service type prior to transfer to the outpatient location. Here is the website for our resources where you can find additional information for surveillance as well as prevention, our training protocols, our data collection forms. If you have questions after today, contact us at the user support mailbox at nhsn@cdc.gov. I want to briefly mention a resource that is available to nursing homes to help them track C. difficile and related processes. The National Nursing Home Quality Improvement Campaign C. difficile infection tracking tool is available. Keep in mind that this tracking tool is not part of NHSN, nor will it automatically submit data. I just wanted to share this with you because it may be a good tool for some of your nursing homes to be able to keep up with a positive laboratory test. Okay, are we ready to have some fun? You can get your clickers out now. On April 1st, Mrs. Griffin, a resident in your skilled nursing facility, had several episodes of diarrhea. The doctor was called and a stool sample was ordered for C. difficile testing. The resident does not have a history of C. difficile, and she does not have a recent history of being in another facility. The next day, on April 2nd, a loose stool sample was collected and sent to the lab. The results came back positive for C. difficile toxin A. Is this a LabID event? So click your clicker. 1 will be yes, 2 is no, 3, I'm not sure. I did something wrong. Okay, how many of you say yes? How many say no? Not sure. Very good. The correct answer is yes. What is the date of the CDI event? The clickers don't work, so we'll have to do this the old school way. Okay, so we answered this one. I don't know if those numbers are correct. We're going to pretend that they're not. Okay. What is the date of event? So number 1 is April 1st, since this was the date the diarrhea started, or April 2, since this was the date the specimen was collected. April 2nd, since this was the date the specimen was collected. I think the clickers are still malfunctioning. Okay. So remember, the date the specimen collected equals the event date for all LabID event reporting. Since the resident has been in your facility for more than 3 calendar days and has not transferred from an acute care facility in the previous 4 weeks, how will the NHSN application categorize this CDI LabID event? Number 1, community onset. Number 2, long-term care facility onset. Or number 3, act low. Are you guys pushing those clickers? Huh? It's not working? Yeah. I think we need to start the training all over. 50% are wrong. I'm just kidding. So number 2, long-term care facility LabID event, since the specimen collection date was greater than 3 days after the current admission date. I apologize. Technology, see, we can sympathize with the frustrations you guys feel with NHSN. What if the resident had spent time in an acute care hospital 10 days ago? How will the NHSN application categorize this CDI LabID event? Number 1, community onset. Number 2, long-term care facility onset. Or number 3, act low. So how many say number 3? Okay. Correct answer is number 3, act low. Since that resident was transferred from an acute care facility in the previous 4 weeks. Mr. Quagmire was first admitted to your nursing home on March 1st. On March 2nd, he had several episodes of diarrhea. A loose stool specimen was collected and positive for C. difficile toxin on March 3rd. Should the C. difficile LabID lab result be submitted to the NHSN application? How many of you say, I don't know? Good job. How many say, yes, all non-duplicate C. difficile assay test results should be reported? Okay. 3, no, he was admitted to our nursing home with C. difficile. I know some of you would say this. So number 2, yes, all non-duplicate C. difficile assays should be reported. So this includes your community onset as well as your long-term care facility onset. How will NHSN categorize this LabID event? Community onset, since the specimen was collected 3 days or less after the current admission. Long-term care facility onset, or act low. How many say community onset? Okay. Long-term care facility onset or act low? Okay. Good job. Community onset, since the specimen was collected on calendar day number 3. So remember, the date of admission equals day 1, as well as the date of specimen collection equals day 1 in the count. Okay. Okay, and this just describes the categorizations again. So, it's lunchtime. I will also take questions. We're a little bit early, so I'll take questions. We have our first question. Hi.
I have a question about the field for on treatment for C. difficile, on antibiotic treatment. How is that defined, and does that include so-called prophylactic treatment? Because sometimes a patient will have had C. diff, they've completed their treatment, their symptoms have resolved, now they're on antibiotics for UTI or pneumonia, and they're back on C. diff treatment prophylactically. Does that count or not?
Any treatment that for C. difficile, regardless how it's deemed, would be considered a yes for that. The resident would be included in that count if the resident was on treatment upon readmission back to the facility. I would say, right, so if there's documentation saying that the resident is receiving a certain treatment for C. difficile, some facilities may have some protocols in place for how to make it easier for users to identify. Maybe there's certain antibiotics that you can look for that aren't specified in our protocol. But I would say that if the resident comes in and there's any indication that the resident's being treated for a C. difficile infection, count them. Does that answer your question? Okay.
Hi, I have 2 questions. One is on the slide 33. It says if the patient has been discharged from acute care facility, so you need to know the date of transfer, and also if the resident was on antibiotic therapy in that facility. I don't know, from the acute care setting, so how are they able to provide that information through the case management, or how do we need to get that information from because it's not required from them from the acute care setting to inform that, right?
So you're asking how they would obtain the information about it being treated for C. difficile infection?
Yeah, because it says we need to know, it's a required field, but that has to be the question asked by the transferring facility. The hand of communication should be there from the transferring facility to the nursing home.
Right.
But I don't know at this point, coming from acute care setting, we provide that information whether this patient was on what type of for the treatment for C. diff.
Right. So that's on the event form that she's referring to, the question about the patient having, read the question one more time so the audience could hear that.
The question is, was the resident directly admitted to your facility from an acute care facility in past 4 weeks? If S selected, additional data must be entered. So date of the transfer from the acute care facility, and if yes, was a resident on antibiotic therapy for this specific organism at the time of transfer to your facility, if the patient was on flagell or not. But I don't think that is all the time that information is passed through.
I agree. Sometimes, or many times, I think that the data collection is going to be a challenge, and perhaps we can come up with some tips as our team on key flags that facilities can look for. You will want to look at of course, the transfer records in the medical record and look for those key antibiotics that the resident may be on, or documentation. If there is not a clear documentation, then you would just select no.
Is there any possibility from NHSN providing for the long-term acute care setting? So what questions needs to be asking if they're receiving the patient from acute care setting? So that might be included in that?
We could definitely talk about that. Would you mind sending that recommendation to our box so that we can review it and some discussions, and I can circle back around to you? I think that's great.
I can do that. And second question I have is in the custom field. When we do the custom field, so do we need to do it for every event, or is once if I do the custom field for that, and will that be recurring throughout my plan? If my plan doesn't change, so then it is custom to my plan.
That's a great question. So the question is around custom fields. How many times do you have to set that up? You can set custom fields up for event, your numerator, your event level, numerator data. You can also set custom fields up for denominator. Once you set them up one time in NHSN, and they're also module specific. So you would set them up for the UTI module and or the LabID event module. And once you set them up one time, then they're set up for all of your data entry.
Thank you.
Great question. Thank you.
Hi, I'm Janet Robinson from the New England QIN/QIO. I also have a question about the custom field. I was thinking with the example you gave how great that would be for facilities to align with their antibiotic stewardship activities. But I didn't understand something. You said that the custom fields have to be set up before data entry. I'm thinking of facilities I've been working with. It was all they could do to get enrolled. They have already started entering data.
Right.
And many of them, and in truth, I have said to them, don't worry about the custom field right now. Let's just get through enrollment. Yes. Does this mean they've lost the opportunity to do that?
Absolutely not. I should have clarified it. It just needs to be set up before you enter an actual event. So a facility can always set up custom fields at any time. So they would not be able to retrospectively. I don't know that it goes retrospective, but let's say the facility set up their custom events today, then going forward, any event they entered, they could use those custom fields.
That's what I want to know. Thank you.
But you know what, Janet, I'm curious, now you have me curious, if that would retro back to events, and we'll have to look at that. I'm not sure that it does. I bet it doesn't. It doesn't. We've had a user, it does not. So it only works from the date you set it up going forward. But, and I would also to that, don't feel bad because we just want to get those facilities enrolled right now. I agree with you.
That's pretty much how I was feeling too.
We will take them to the next level after we get them enrolled. And if you guys are interested, that's something that we could create a guidance document for you and put on our website. It sounds like we have some interest in the room, and I think custom fields are great, and I would love to see more facilities take advantage of them. So we will work on that. And we already have one? Oh, on the acute care side. We'll have to do one just for the long-term care side. So, okay. We do have a question from a web streamer. So, Emily, are you going to read me the question?
If I can get the mic on. Hello? Oh, there we go. Sorry. So we do have a question from the web stream audience, and it is in regards to reporting, and Anttila, this is from pretty early on, I think an example you gave early on. In regards to reporting a C. diff on a long-term care resident that was tested in the ED and returned to the long-term care facility Following your exemption, I would report this in the long-term care CDI LabID event. I also have to report CDI for specimens collected in the ED. So how do I follow both? Would I be double reporting this event?
So that's a great question. I'm assuming is this coming from an acute care facility?
It says long-term care facility.
Okay. Reporting for emergency department is on the acute care side. So I would imagine the facility that's asking the question is reporting two different components. So it would be okay. They would report it once to meet the requirements for the patient safety component for acute care facilities, and then again to meet the requirements for the long-term care facility component. Great question. Thank you. Okay, so we're 3 minutes early, and I will see you guys back after lunch at 1.